In conducting an initial assessment for a client using the Functional Independence Measure FIM, an occupational therapist observes that the client requires minimal assistance to perform dressing. However, when assessing self-feeding, the client requires moderate assistance. How should the therapist score these activities on the FIM, and what principles guide this scoring process? Answer: the Functional Independence Measure FIM is a widely used tool in rehabilitation to assess a client's functional independence in various activities of daily living adults. For dressing, if the client requires minimal assistance, the appropriate FIM score would be 4, indicating that the client can perform 75% or more of the task independently with only slight help needed. In contrast, for self-feeding, which requires moderate assistance, the therapist should score this activity as a 3, reflecting that the client is performing 50.74% of the task but still requires more significant support. The guiding principles for FIM scoring emphasize objectivity and standardization to ensure consistency across different therapists and settings. Each score is derived from careful observation, reflecting the client's actual performance rather than potential performance. This objectivity is vital for accurately measuring progress over time and evaluating the effectiveness of interventions. The FIM is also aligned with the World Health Organization's International Classification of Functioning, Disability, and Health, focusing on the interaction between health conditions and functioning in various life situations. Thus, scoring should be performed by trained professionals who can accurately assess and document the level of assistance required, ensuring reliable data for treatment planning and outcome measurement. An occupational therapist is working with a diverse client population, including individuals from non-Western cultural backgrounds. How should the therapist approach the adaptation of standardized assessment tools, and what ethical principles must guide these adaptations? Answer: when adapting standardized assessment tools for clients from diverse cultural backgrounds, occupational therapists must carefully consider cultural nuances, language barriers, and different social norms that may affect assessment outcomes. The therapist should first conduct a cultural assessment to understand the client's background and how it might influence their performance on standardized assessments. It is essential to adapt tools to be culturally relevant while preserving the validity and reliability of the assessments. Ethical principles such as justice and beneficence should guide this adaptation process. Justice requires therapists to ensure that all clients have equitable access to assessments that accurately reflect their abilities, without bias introduced by cultural differences. For example, if a standardized assessment includes scenarios or examples that are culturally specific, the therapist may need to modify these to ensure they are applicable to the client's cultural context. Additionally, clear documentation of any adaptations made during the assessment process is vital. This not only provides transparency in the evaluation process, but also safeguards the integrity of the results. MS Patel is a new client who reports chronic pain that limits her ability to complete daily activities. During the initial assessment interview, she mentions previous negative experiences with healthcare professionals who did not respect her privacy. As her occupational therapist, what should you prioritize in the evaluation process to address MS Patel's concerns, and what legal guidelines are relevant here? Answer: in this scenario, the occupational therapist should prioritize establishing a trusting therapeutic relationship with MS Patel by ensuring that her privacy and confidentiality are upheld throughout the evaluation process. To address MS Patel's concerns about her previous negative experiences, the therapist should begin the session by openly discussing confidentiality policies, specifically the Health Insurance Portability and Accountability Act, HIPAA. The therapist should explain that all information shared will be kept private and secure, only disclosed to authorized personnel involved in her care, and that she has control over her information. Additionally, the therapist should demonstrate active listening, empathy, and validation of MS Patel's feelings regarding her past experiences. By allowing MS Patel to express her concerns and preferences during the assessment process, the therapist reinforces her autonomy and acknowledges the importance of client-centered care. Legal guidelines mandate that healthcare professionals must comply with HIPAA regulations, which require the safeguarding of client information. The therapist must document any disclosures and the client's consent to share information. What is the importance of accuracy and confidentiality in record-keeping for occupational therapy, and what laws mandate these requirements? Answer: accuracy and confidentiality in record-keeping are paramount in occupational therapy for several reasons. First, accurate documentation ensures that a client's progress, treatment plans, and responses to interventions are recorded correctly, which is essential for continuity of care. Inaccurate records can lead to misunderstandings regarding a client's needs and can adversely affect treatment outcomes. Clear and precise documentation is also vital for billing and compliance with insurance requirements, ensuring that services rendered are properly justified. Confidentiality, governed primarily by the Health Insurance Portability and Accountability Act, HIPAA, mandates that clients' health information is protected from unauthorized access. HIPAA establishes strict rules regarding who can access client records and under what circumstances information can be disclosed. Occupational therapists must implement safeguards to protect sensitive information and ensure that clients are aware of their rights concerning their health information. Moreover, the American Occupational Therapy Association (AOTA) outlines ethical standards that emphasize the need for confidentiality in practice. Therapists must respect client privacy by only sharing information pertinent to the client's treatment with those directly involved in their care. When writing goals for a client in occupational therapy, what elements should be included to make the goals measurable and achievable, and why are these elements crucial? Answer: when writing goals for clients in occupational therapy, the SMART criteria are essential to ensure that goals are specific, measurable, achievable, relevant, and time-bound. Each of these elements plays a critical role in the goal-setting process. Specific goals should clearly outline what the client aims to achieve. For instance, instead of a vague goal like improved mobility, a specific goal would state, the client will walk 100 feet using a walker without assistance. Measurable. This aspect allows therapists to track progress objectively. Measurable goals should include quantifiable criteria such as distance walked, number of repetitions, or percentage of independence. Achievable goals must be realistic considering the client's current abilities and potential for improvement. Setting achievable goals motivates clients and fosters a sense of accomplishment. Relevant goals should align with the client's needs, preferences, and functional priorities, ensuring that they are meaningful and directly related to the client's daily activities. Time-bound. Setting a timeline for achieving goals creates a sense of urgency and allows for periodic assessment of progress. For example, the client will achieve this goal within 6 weeks, provides a clear time frame for evaluation. Incorporating these elements into goal setting is crucial as it promotes accountability and focus in therapy sessions. It allows both the therapist and the client to have a shared understanding of expected outcomes and facilitates motivation by providing clear benchmarks for success. Furthermore, well-defined goals enhance communication between the therapist, client, and any other stakeholders involved in the client's care, ensuring that everyone is aligned in the treatment process. Why is it important for occupational therapists to consider environmental factors when analyzing activity demands in an evaluation? Provide an example of how environmental factors could impact a client's ability to perform a daily activity. Answer: considering environmental factors when analyzing activity demands in occupational therapy is crucial because the environment significantly influences a client's performance and engagement in daily activities. Environmental factors can include physical elements such as layout and accessibility, social supports, cultural context, and even economic conditions. By assessing these factors, therapists can identify barriers to participation and tailor interventions accordingly. For instance, a client with limited mobility may have difficulty navigating their home if it is not wheelchair accessible with narrow doorways, steps, and inadequate lighting. In this case, even if the client has the physical capability to perform certain activities such as cooking or self-care, the environmental barriers may hinder their ability to do so independently. By evaluating environmental factors, the occupational therapist can suggest modifications that promote accessibility and safety, such as installing grab bars, using adaptive equipment, or rearranging furniture for easier navigation. This holistic approach not only addresses the client's physical limitations but also empowers them to engage in meaningful activities within their environment, ultimately enhancing their quality of life. During an evaluation, an occupational therapist utilizes both standardized and non-standardized assessments. Explain the advantages of combining these methods and provide an example of how each type contributes to a holistic evaluation. Answer: combining standardized and non-standardized assessments in occupational therapy provides a comprehensive evaluation that captures a client's abilities, challenges, and contextual factors. Each assessment type offers distinct advantages that, when used together, enrich the understanding of the client's functional status. Standardized assessments offer objective measures that allow for comparison across populations and provide normative data. They are typically reliable and valid, ensuring that the results can be generalized to a broader population. For example, the Barthel Index is a standardized assessment that measures a client's ability to perform basic activities of daily living adults and provides quantifiable data that can help in tracking progress over time. On the other hand, non-standardized assessments are more subjective and can be tailored to the individual client's specific context, preferences, and unique challenges. These assessments often involve observational methods, interviews, or self-report questionnaires. For instance, a client's narrative about their daily routines and obstacles encountered in their home environment provides invaluable insights into their lived experience, which standardized assessments may overlook. Combining both methods enhances the evaluation process by integrating quantitative data from standardized assessments with qualitative insights from non-standardized methods. This holistic approach allows the occupational therapist to develop a more complete understanding of the client's strengths and limitations, leading to more effective, personalized intervention strategies. For example, a standardized assessment may indicate that a client has difficulty with self-care, while a non-standardized assessment could reveal specific environmental barriers contributing to this difficulty, guiding targeted interventions that address both individual capabilities and contextual challenges. An occupational therapist is designing a home exercise program for a client recovering from a stroke. What key principles should the therapist incorporate to ensure the program is effective and safe, and how can they assess the client's progress? Answer: when designing a home exercise program for a client recovering from a stroke, the occupational therapist should incorporate several key principles to ensure the program is effective and safe. Individualization. The program must be tailored to the client's specific needs, abilities, and functional goals. It should take into account the severity of the stroke, the client's prior level of function, and any existing comorbidities. Progressive overload. Gradually increasing the intensity, duration, or complexity of exercises can help enhance strength, endurance, and coordination. This principle encourages continuous improvement while reducing the risk of injury. Safety. The therapist should provide clear instructions on how to perform each exercise safely, including proper body mechanics and techniques. It is also important to ensure that the client has a safe space to perform exercises free from obstacles that could lead to falls. Frequency and consistency. Establishing a routine is vital for adherence. The program should outline specific days and times for exercise to help the client incorporate these activities into their daily routine. Motivation and engagement. Incorporating activities that the client enjoys can enhance motivation. The therapist should encourage the client to set achievable goals and celebrate milestones, fostering a positive attitude towards rehabilitation. To assess the client's progress, the occupational therapist can employ both subjective and objective measures. Regularly scheduled follow-ups can include reassessing functional abilities using standardized tools such as the Fugl-Meyer Assessment for Motor Recovery or the National Institutes of Health Stroke Scale (NIS). Additionally, self-reports or daily logs from the client about their exercise experiences, perceived exertion, and any challenges faced can provide qualitative insights into their progress. Continuous monitoring allows for adjustments to the exercise program as needed, ensuring that it remains aligned with the client's recovery journey and evolving needs. How can occupational therapists facilitate client-centered care during interventions, and what specific strategies can be implemented to enhance client engagement in the therapeutic process? Answer: occupational therapists can facilitate client-centered care during interventions by actively involving clients in their treatment planning and decision-making processes. Client-centered care prioritizes the client's preferences, needs, and goals, fostering a collaborative therapeutic relationship. To enhance client engagement, therapists can implement several specific strategies. Active listening. Therapists should practice active listening techniques to fully understand the client's concerns, experiences, and goals. This approach creates an open dialogue where clients feel heard and valued, promoting trust and collaboration. Goal setting. Involving clients in the goal-setting process ensures that the goals reflect their interests and priorities. Therapists can use motivational interviewing techniques to guide discussions around meaningful goals, helping clients articulate what they hope to achieve through therapy. Choice and control. Providing clients with options regarding their treatment can enhance their sense of control over the therapeutic process. Therapists can present various intervention strategies and allow clients to choose the ones they prefer, fostering ownership of their recovery journey. Education and information sharing. Educating clients about their condition, treatment options, and the rationale behind interventions empowers them to make informed decisions. Providing clear and accessible information helps clients understand the purpose of therapy, enhancing their engagement. Feedback and adaptation. Regularly soliciting feedback from clients about their experiences with therapy allows for adjustments based on their preferences and responses. Therapists can create a flexible approach, modifying interventions to better suit the client's evolving needs and desires. By implementing these strategies, occupational therapists create a therapeutic environment that is not only supportive but also empowering, encouraging clients to take an active role in their recovery process. This engagement is critical for achieving meaningful outcomes and improving the overall effectiveness of interventions. Discuss the role of evidence-based practice in occupational therapy and provide an example of how it can be applied in clinical decision-making. Answer: evidence-based practice in occupational therapy integrates the best available research evidence with clinical expertise and client values to guide decision-making and improve client outcomes. BP is essential as it promotes the use of interventions that have been scientifically validated, ensuring that clients receive effective and efficient care. The role of BP involves several key components. Formulating clinical questions. Therapists begin by identifying clinical questions related to specific client needs, which may arise from observations, client feedback, or emerging trends in practice. Searching for evidence. Therapists engage in systematic searches for high-quality research studies, clinical guidelines, and systematic reviews that address their clinical questions. Resources like peer-reviewed journals, databases such as PubMed, and professional organization guidelines are valuable in this process. Critical appraisal. Once evidence is gathered, therapists critically evaluate the quality and applicability of the research findings. They assess the methodology, sample size, and relevance of the studies to their specific client populations. Implementation. Therapists apply the best evidence in conjunction with their clinical expertise and the client's preferences to design and implement interventions tailored to the client's unique circumstances. Evaluation of outcomes. Finally, therapists assess the effectiveness of the applied interventions using both quantitative and qualitative measures to determine if client goals are being met. For example, if an occupational therapist is treating a client with a stroke who is struggling with hand function, they may reference recent systematic reviews on the efficacy of task-oriented training. After reviewing evidence supporting the effectiveness of task-specific practice in improving hand function, the therapist can implement a structured program of repetitive, functional tasks that are meaningful to the client, such as picking up objects or buttoning shirts. This evidence-based approach not only enhances the relevance and effectiveness of therapy, but also empowers the client by engaging them in meaningful activities that promote recovery. Explain the key differences between occupation-based approaches and skills-focused approaches in occupational therapy intervention. How does each approach impact client outcomes differently? Answer: in occupational therapy, occupation-based approaches and skills-focused approaches serve distinct yet complementary roles in facilitating client rehabilitation. Occupation-based approaches emphasize engaging clients in meaningful and relevant activities that reflect their daily lives, thereby enhancing motivation and satisfaction. For example, if a client enjoys gardening, an occupational therapist might integrate gardening tasks into therapy to promote strength and coordination while fostering emotional well-being through engagement in a preferred activity. This method is grounded in the belief that participating in meaningful occupations leads to better mental health outcomes, improved quality of life, and increased engagement in daily routines. In contrast, skills-focused approaches prioritize developing specific skills necessary for task completion. This might involve direct training on particular abilities, such as fine motor skills or cognitive strategies to build the foundation for performing complex tasks. For instance, a therapist might utilize pegboards to enhance fine motor coordination as a precursor to enabling a client to button their shirt. While skills-focused interventions are essential for addressing specific deficits, they can sometimes lead to disconnection from the client's meaningful context. Sarah, an occupational therapist, is working with a client who recently had a stroke. The client has significant weakness on their right side, making activities of daily living adults challenging. Sarah is considering using neuromuscular re-education to improve the client's functional mobility. What principles should Sarah follow when using neuromuscular re-education for stroke rehabilitation, and what are the potential benefits of this approach? Answer: when utilizing neuromuscular re-education for a client recovering from a stroke, Sarah should adhere to several fundamental principles to maximize effectiveness and promote functional mobility. First, she must focus on task-specific training, which integrates movements that the client will need in daily life. This could involve simulating a DLS during therapy sessions, such as reaching for objects or practicing transfers from sitting to standing. Another principle is graded resistance, which involves adjusting the difficulty of tasks as the client's abilities improve. This might mean starting with passive range of motion exercises and progressively moving to active assisted and eventually independent movements as the client's strength and coordination enhance. Repetition and practice are critical as consistent engagement helps to reinforce new neural pathways and improve motor control. Incorporating proprioceptive feedback is also essential. This can be achieved through activities that require the client to sense their limb position and movement, such as balancing tasks on unstable surfaces or using resistance bands to enhance kinesthetic awareness. The potential benefits of neuromuscular re-education for stroke rehabilitation are significant. This approach can lead to improved muscle activation and coordination, reduced spasticity, and increased strength in the affected limb. Mr. Nguyen, 75, has been diagnosed with early-stage dementia. His family is concerned about his safety at home, particularly with respect to cooking and managing medications. They also report that he has difficulty remembering appointments and occasionally becomes disoriented when navigating his neighborhood. Question: as an occupational therapist, what steps should you take to address Mr. Nguyen's safety and functional independence, and which interventions would be most beneficial in this case? Answer: as an occupational therapist, addressing Mr. Nguyen's needs, a holistic and client-centered approach is vital. First, conducting a comprehensive home assessment is essential to identify potential safety hazards, particularly in areas such as the kitchen and bathroom. Based on the assessment, specific interventions can be implemented. Cognitive rehabilitation strategies should be employed, focusing on memory enhancement and organizational skills. For example, using visual aids like a large, clearly labeled calendar can help Mr. Nguyen keep track of appointments and medication schedules. Additionally, setting up a routine that emphasizes consistency can support his ability to remember daily tasks. Home modifications play a critical role in enhancing safety. This might involve installing grab bars in the bathroom, using automatic shut-off devices on stoves, and labeling cabinets and drawers to simplify navigation. Utilizing adaptive tools, such as pre-measured medication dispensers and meal preparation kits, can further support his independence in managing daily tasks. To address his disorientation, community mobility training could be beneficial. This could involve accompanying Mr. Nguyen on neighborhood walks to reinforce familiar routes and establish landmarks, boosting his confidence in navigating his environment. Lastly, involving family members in the therapeutic process ensures they are educated about Mr. Nguyen's needs and can assist him effectively. By integrating cognitive support, environmental modifications, and family education, the intervention plan can significantly enhance Mr. Nguyen's safety and independence while promoting a higher quality of life. What is the role of universal design in occupational therapy, particularly in relation to aging in place? Describe 3 examples of universal design elements that can support older adults' independence in their homes. Answer: universal design plays a pivotal role in occupational therapy by creating environments that are accessible and functional for individuals of all ages and abilities. This design philosophy is particularly significant for older adults who wish to age in place, as it promotes independence, safety, and comfort in their living environments. The core principle of universal design is that products and spaces should be usable by all people, regardless of their physical or cognitive abilities. 3 exemplary elements of universal design that support older adults include lever door handles. Unlike traditional round knobs, lever handles are easier for individuals with limited hand strength or dexterity to operate. They can be opened with a simple push or pull, allowing for more accessible entry and exit from rooms without straining the joints. No-step entrances. Incorporating no-step entries eliminates physical barriers that can impede mobility, particularly for individuals using wheelchairs or walkers. This design feature allows for easier access and enhances safety by reducing the risk of falls that can occur when navigating stairs. Adjustable shelving and cabinets. Shelving units that can be adjusted in height accommodate the varying reach and physical capabilities of older adults. Lowering kitchen cabinets or incorporating pull-out shelves minimizes the need for stretching or bending, making items more accessible and encouraging greater independence in meal preparation and other daily tasks. By integrating universal design elements, occupational therapists can create home environments that empower older adults to live independently and safely while significantly reducing the need for assistance in their daily activities. Explain the concept of compensatory techniques in cognitive rehabilitation and give an example of how these techniques can be applied to assist a client with memory deficits. Answer: compensatory techniques in cognitive rehabilitation refer to strategies that help individuals work around their cognitive deficits, particularly memory issues, rather than trying to restore lost functions. These techniques focus on modifying the environment or using external tools to support cognitive tasks, thereby enhancing the client's ability to manage daily activities and maintain independence. For a client with memory deficits, one effective compensatory technique is the use of memory aids, such as electronic reminders and apps. For instance, the client could utilize a smartphone calendar or a dedicated medication management app that sends alerts for taking medications, appointments, and important tasks. This not only assists in remembering these tasks, but also encourages the client to engage with technology, which can improve cognitive skills through practice. Another example of a compensatory technique is the use of a visual schedule or checklist. By breaking down daily routines into visual steps, such as a morning routine that includes brushing teeth, getting dressed, and having breakfast, clients can refer to the checklist to stay on track. This visual support helps reduce cognitive load and anxiety, allowing the client to focus on completing one task at a time. These compensatory techniques empower clients with memory deficits to manage their daily lives more effectively, promoting autonomy while accommodating their cognitive challenges. The integration of these strategies into therapy not only aids in task completion but also fosters a sense of accomplishment and confidence in clients. During an initial assessment, you observe that a client has limited shoulder mobility and struggles to perform grooming activities independently. What adaptive equipment might you recommend to facilitate grooming tasks, and what is the rationale behind each recommendation? Answer: in addressing a client with limited shoulder mobility who has difficulty performing grooming activities, recommending appropriate adaptive equipment can significantly enhance independence and ease of task completion. Several tools can be introduced to support the client in their grooming routine. Long-handled brushes and combs. These tools are designed to allow clients to groom themselves without needing to raise their arms above shoulder level, which can exacerbate discomfort or pain. The extended handles facilitate reaching the back of the head or other areas without straining, making daily grooming more manageable. Button hooks and zipper pulls. For clients struggling with dressing, these adaptive devices can help fasten clothing with minimal shoulder movement. Button hooks enable individuals to easily pull buttons through their buttonholes, while zipper pulls assist in navigating zippers, both of which are critical for self-dressing. These tools promote independence by reducing reliance on caregivers for dressing tasks. Ergonomically designed grooming tools. Using grooming tools with contoured grips can provide better control and comfort for clients with limited grip strength or dexterity. Tools such as electric toothbrushes with larger handles can minimize the effort needed to maintain oral hygiene while improving effectiveness. Shower brushes and loofahs on a stick. These devices enable clients to reach their entire body while bathing without excessive shoulder movement. A long-handled shower brush helps with washing the back and feet, ensuring that clients can maintain personal hygiene independently. The rationale behind these recommendations is to promote functional independence while considering the client's physical limitations. By integrating adaptive equipment into their daily routine, clients can maintain their grooming habits, enhance self-esteem, and experience a greater sense of autonomy in their personal care. How can sensory integration therapy be beneficial for children with autism spectrum disorder? Asked. Discuss the theoretical framework behind sensory integration and provide an example of an intervention. Answer: sensory integration therapy is an intervention designed to help children with autism spectrum disorder process and respond to sensory information effectively. The theoretical framework behind sensory integration, developed by occupational therapist A. Gines, posits that sensory processing issues can hinder a child's ability to engage with their environment, affecting their behavior, learning, and overall development. Children with ASD often experience sensory sensitivities or aversions, leading to difficulties in daily functioning and social interactions. Sensory integration therapy aims to enhance a child's ability to modulate sensory input and integrate multiple sensory modalities, thereby improving their adaptive responses. This therapy often involves play-based activities tailored to the child's sensory preferences and aversions, facilitating a safe environment to explore sensory experiences. One example of an intervention is the use of a sensory play area equipped with various tactile materials, swings, and climbing structures. In this setting, children can engage in activities such as swinging, jumping on trampolines, or playing with textured toys. These activities encourage sensory exploration and help children learn to manage their responses to different sensory inputs, promoting improved motor skills, coordination, and social engagement. Additionally, occupational therapists may employ strategies such as deep pressure activities like squeezing therapy balls or using weighted blankets. These methods provide proprioceptive input, which can be calming and grounding for children with sensory sensitivities, aiding in self-regulation and reducing anxiety. Research indicates that sensory integration therapy can lead to improved sensory processing abilities, enhanced attention and focus, and greater participation in social activities. ultimately supporting the overall development of children with ASD. Discuss the importance of client-centered practice in occupational therapy. How does it differ from traditional therapeutic approaches, and what are the key components of implementing a client-centered approach? Answer: client-centered practice is a foundational principle in occupational therapy that emphasizes the importance of understanding and prioritizing the individual needs, preferences, and goals of clients in their rehabilitation process. This approach is rooted in the belief that clients are the experts of their own experiences and that effective therapy must be tailored to their unique contexts and aspirations. In contrast to traditional therapeutic approaches, which may focus primarily on the therapist's expertise and predetermined goals, client-centered practice fosters collaboration and partnership between the therapist and client. This shift allows for more meaningful engagement in the therapy process, promoting motivation and commitment to achieving personal goals. Key components of implementing a client-centered approach include collaborative goal setting. Engaging clients in identifying their own goals and priorities ensures that therapy is relevant to their lives. This process enhances motivation and facilitates a sense of ownership over the rehabilitation journey. Holistic assessment. A thorough understanding of the client's physical, emotional, social, and environmental context is crucial. Occupational therapists should assess not only physical capabilities, but also the client's lifestyle, values, and the challenges they face in their daily lives. Empowerment and advocacy. Client-centered practice promotes empowerment by providing clients with the knowledge and tools necessary to make informed decisions about their care. Therapists also advocate for clients' needs within the healthcare system, ensuring that their voices are heard. Flexibility and adaptability. As clients progress, their needs and goals may evolve. A client-centered approach requires therapists to remain adaptable, modifying interventions as needed to align with changing circumstances and preferences. Research demonstrates that client-centered practice leads to improved therapy outcomes, higher client satisfaction, and enhanced quality of life. By placing clients at the heart of the therapeutic process, occupational therapists can facilitate meaningful and lasting change in their clients' lives. What are the ethical considerations an occupational therapist must keep in mind when working with vulnerable populations, such as individuals with cognitive impairments? Provide 2 examples of ethical dilemmas that may arise in practice. Answer: when working with vulnerable populations, such as individuals with cognitive impairments, occupational therapists must navigate a range of ethical considerations to ensure respectful, effective, and compassionate care. Key principles guiding ethical practice include autonomy, beneficence, non-maleficence, and justice. Autonomy and informed consent. Individuals with cognitive impairments may have limited capacity to make informed decisions about their treatment. Therapists must strive to ensure that clients understand their options and the implications of their choices. This can be challenging when determining the degree to which clients can participate in decision-making processes. For instance, if a client with dementia refuses a recommended intervention, the therapist must weigh respecting the client's autonomy against the potential benefits of the intervention. Beneficence and non-maleficence. Therapists have an ethical obligation to act in the best interests of their clients while avoiding harm. This can lead to dilemmas when interventions that could benefit the client may cause distress or discomfort. For example, if a client requires a particular therapeutic exercise that elicits anxiety or fear, the therapist faces the challenge of balancing the need for progress with the emotional well-being of the client. Additionally, therapists must be vigilant about the potential for exploitation or neglect, particularly when working with individuals who may be unable to advocate for themselves. This emphasizes the need for ongoing communication with family members and caregivers, ensuring that the client's best interests are upheld in all aspects of care. Overall, ethical considerations in occupational therapy necessitate a thoughtful approach that prioritizes the dignity and rights of vulnerable clients while promoting their health and well-being. Describe the role of interdisciplinary collaboration in occupational therapy. How can effective teamwork enhance client outcomes, and what strategies can be employed to foster successful collaboration among team members? Answer: interdisciplinary collaboration in occupational therapy is essential for delivering comprehensive and holistic care to clients. Occupational therapists often work alongside various healthcare professionals, including physical therapists, speech-language pathologists, social workers, and physicians, to address the multifaceted needs of clients. This collaborative approach allows for the integration of diverse expertise, ultimately enhancing client outcomes. Effective teamwork enhances client care by ensuring that all aspects of a client's health and functioning are addressed, For example, a client recovering from a stroke may benefit from occupational therapy focused on daily living skills, while a physical therapist may work on mobility and strength. By coordinating their efforts, therapists can create a more cohesive rehabilitation plan that optimizes the client's progress and addresses all relevant domains of recovery. To foster successful collaboration among team members, several strategies can be employed. Regular interdisciplinary meetings, scheduling routine meetings where team members can discuss client progress, share insights, and adjust treatment plans collaboratively is crucial. This practice promotes open communication and alignment on goals, role clarity, and mutual respect. Clearly defining each team member's roles and responsibilities helps to prevent overlap and confusion. It is equally important to respect each professional's expertise and contributions, fostering an environment of collaboration and support. Share goals. Establishing common goals that reflect the client's overall well-being encourages a unified approach to care. Team members should work together to create a shared vision for the client's rehabilitation, ensuring that everyone is invested in achieving the same outcomes. Continuous professional development, engaging in interdisciplinary training sessions can enhance understanding of each discipline's practices and challenges. This knowledge fosters empathy and encourages collaborative problem solving among team members. A 78-year-old client presents with multiple functional deficits following a stroke, including weakness in the left arm and cognitive impairment impacting daily tasks. The client lives alone and wishes to regain independence in activities of daily living adults. Which primary factors should the occupational therapist prioritize when setting goals and why? Answer: when setting goals for a client post-stroke, the occupational therapist must prioritize several key factors. Safety: the client's cognitive abilities and their desired adults. Safety is paramount, especially since the client is living alone and the therapist must assess the environment for potential hazards, e.g., falls, kitchen safety, and recommend modifications. Cognitive impairment necessitates a tailored approach. For instance, the therapist may implement strategies that simplify tasks and enhance memory, such as using visual aids or checklists. Additionally, involving the client in goal setting is crucial to ensure that the objectives align with their personal values and motivations, fostering a sense of autonomy and engagement. The therapist may utilize a client-centered approach, focusing on meaningful activities such as preparing meals or maintaining personal hygiene. Goal prioritization could follow the SMART criteria: specific, measurable, achievable, relevant, and time-bound. To create clear objectives, for example, a goal could be the client will independently dress themselves using adaptive methods within 6 weeks. This structured approach not only addresses functional deficits but also supports psychological well-being by promoting independence. During a session, you notice that a client struggling with Parkinson's disease has considerable difficulty using fine motor skills to button shirts. Explain an adaptive strategy you might introduce and why it would be suitable in this scenario. Answer: in the context of Parkinson's disease, where fine motor skills are often impaired due to tremors and rigidity, introducing adaptive tools is essential for enhancing the client's independence and confidence in daily activities. One effective strategy is the use of a button hook, a simple device that allows the user to easily grasp and manipulate buttons without relying heavily on fine motor control. This tool can significantly reduce frustration and time spent on dressing, which is crucial for maintaining the client's dignity and autonomy. Additionally, considering the client's overall context, the occupational therapist could recommend clothing modifications, such as opting for shirts with Velcro or magnetic closures instead of traditional buttons. This change not only addresses the immediate functional limitation but also simplifies the dressing process, making it more manageable for the client. The rationale behind using adaptive strategies lies in the underlying principles of task analysis and environmental modification. By breaking down tasks into smaller, manageable components and adjusting the environment, therapists can help clients regain confidence in their abilities. Providing training on how to use these tools effectively will empower the client, fostering a sense of accomplishment. Mr. Jefferson, a 65-year-old client with mild cognitive impairment, has expressed a strong desire to continue cooking independently despite safety concerns identified by his family. He lives alone and has experienced minor burns and left the stove on in the past. How should the occupational therapist approach this situation to balance client autonomy with safety? Answer: the occupational therapist's approach to this situation must center on respecting Mr. Jefferson's autonomy while also addressing legitimate safety concerns. Initiating a thorough assessment of Mr. Jefferson's cognitive function and daily living skills is the first step. The therapist should engage him in a dialogue about his cooking preferences, emphasizing the importance of safety and the potential risks associated with cooking independently. To balance autonomy and safety, the therapist can propose adaptive strategies and environmental modifications. For instance, introducing adaptive tools such as stove guards, timers, or automatic shut-off devices can help mitigate risks while allowing Mr. Jefferson to pursue his passion for cooking. The therapist could also suggest meal prepping strategies where he prepares meals in advance to reduce the need for daily cooking, thus minimizing exposure to potential hazards. Furthermore, involving Mr. Jefferson in developing a safety plan that includes specific emergency procedures like how to turn off the stove or what to do in case of a fire can empower him while ensuring he understands the implications of his choices. Documenting the conversation and Mr. Jefferson's preferences is essential as it establishes informed consent and acknowledges his right to make choices about his care. A client recovering from a hip replacement has reached a plateau in mobility but expresses frustration and a desire for continued improvement. What is the most appropriate approach for the occupational therapist in this situation? Answer: when a client recovering from a hip replacement reaches a plateau in mobility, it is vital for the occupational therapist to reassess the current intervention strategies while maintaining an open line of communication with the client. The therapist should first conduct a comprehensive evaluation to identify any physical or psychosocial barriers to further progress, such as pain levels, strength, or motivation. A collaborative approach is essential. The therapist should engage the client in discussions about their feelings of frustration and the importance of setting realistic expectations. Exploring the client's goals beyond mobility, such as independence in adults, social engagement, or leisure activities, can help shift focus and reinvigorate motivation. If progress in mobility is limited, the therapist might consider diversifying the intervention plan by introducing new functional tasks that challenge the client in different ways. For example, activities like gardening or light housework may encourage movement while also being aligned with the client's interests. Additionally, incorporating strength training or balance exercises may enhance overall function. The therapist should also educate the client about the recovery process and the potential for nonlinear progression, emphasizing that plateaus are common. Setting new, achievable goals can foster a sense of accomplishment, helping to alleviate frustration and encourage continued participation in therapy. Relevant guideline: the OTPF advocates for an individualized approach that considers the client's context and preferences, ensuring that interventions remain meaningful and engaging while addressing current limitations. An occupational therapist working with a minor with developmental disabilities is pressured by the client's parents to provide reports that may inaccurately represent the client's functional capacity for educational funding purposes. How should the therapist address this situation? Answer: in this situation, the occupational therapist must navigate a delicate balance between parental expectations and ethical obligations to provide accurate and truthful documentation. The therapist should first ensure that they are well informed about the client's true functional capacities through thorough assessment and observation. Clear and objective documentation of the client's abilities is crucial as it provides a factual basis for any reports generated. To address the parent's pressure, the therapist should engage in an open dialogue explaining the importance of ethical standards in practice, particularly the potential consequences of misrepresenting a client's capabilities. The therapist can emphasize that honest assessments not only serve the client's best interests in the long run, but also ensure that they receive appropriate supports tailored to their actual needs. If the parents persist in their request, the therapist might consider consulting with a supervisor or an ethics committee to discuss the situation and seek guidance on how to proceed. It is essential to document all communications with the parents regarding their requests, the therapist's responses, and any steps taken to resolve the ethical dilemma. In a multidisciplinary team setting, an occupational therapist is working with a physical therapist and speech therapist to create a treatment plan for a stroke patient with mobility and speech deficits. What key strategies should the occupational therapist use to foster effective collaboration and continuity of care? Answer: to foster effective collaboration and continuity of care in a multidisciplinary team, the occupational therapist should adopt several key strategies. First, initiating regular interdisciplinary meetings is crucial, allowing all team members to share insights, progress updates, and concerns about the patient's treatment. This collaborative dialogue promotes a unified approach to care, ensuring that all team members are on the same page regarding the client's goals and interventions. The occupational therapist should also articulate their observations and recommendations clearly, using common language that all professionals can understand. providing written documentation that outlines the treatment plan, including specific roles for each team member, can enhance clarity and accountability. Additionally, the therapist can advocate for the client by emphasizing the importance of addressing the interconnections between mobility and communication deficits. For instance, by working with the speech therapist to incorporate functional communication goals into the occupational therapy sessions, the team can create a more holistic treatment plan that addresses the client's needs across multiple domains. It is also essential for the occupational therapist to actively listen to input from other disciplines and be open to integrating their expertise into the treatment plan. Building rapport and mutual respect among team members fosters an environment of collaboration, ultimately benefiting the patient's recovery process. A relevant guideline. The IATA standards of practice emphasize the importance of collaborative practice and interprofessional communication, recognizing that coordinated care enhances client outcomes and promotes comprehensive treatment approaches. A quality improvement initiative aims to enhance client satisfaction in an outpatient occupational therapy clinic. What strategies should be implemented to ensure the incorporation of client feedback into service delivery improvements? Answer: implementing a quality improvement initiative focused on client satisfaction requires a structured approach to gather, analyze, and act on client feedback. The occupational therapist should begin by developing and distributing satisfaction surveys that cover various aspects of the service, including the quality of care, communication, and overall experience. These surveys can be administered periodically to capture trends over time and allow for actionable insights. Additionally, conducting focus groups or individual interviews with clients can provide qualitative data that surveys might not capture. This direct interaction fosters a deeper understanding of client perspectives and preferences, allowing the therapist to identify specific areas for improvement. Once feedback is collected, the next step is to analyze the data to identify common themes and prioritize areas for improvement. The occupational therapist should involve the entire team in discussions about the findings, encouraging brainstorming sessions to develop strategies that address the identified concerns. Implementing changes based on client feedback should be communicated transparently to clients, showcasing the clinic's commitment to continuous improvement and responsiveness to their needs. Follow-up assessments can help evaluate the effectiveness of these changes, allowing for ongoing adjustments as necessary. Lastly, integrating evidence-based practice by reviewing current literature on client satisfaction and best practices in occupational therapy can inform the improvement strategies, ensuring that the interventions are grounded in research. Relevant guideline. IATA's Vision 2025 highlights the need for occupational therapy practitioners to engage in quality improvement initiatives, demonstrating accountability for the quality of care provided and fostering client-centered practice. An occupational therapist is working with a client from a cultural background that values family involvement in healthcare decisions. How should the therapist ensure culturally competent care while respecting the client's autonomy? Answer: providing culturally competent care while respecting a client's autonomy involves a delicate balance of understanding cultural values and honoring individual preferences. The occupational therapist should begin by engaging the client in conversations about their cultural beliefs, family dynamics, and preferences regarding healthcare decisions. This dialogue can help the therapist understand the role of family in the client's life and how it may influence treatment goals. In practice, the therapist should encourage family involvement in the therapeutic process, inviting family members to participate in sessions when appropriate and ensuring they are informed about the client's goals and progress. This inclusion can enhance the client's comfort level and support their emotional well-being, aligning with the cultural value of family involvement. However, it is equally important for the therapist to advocate for the client's autonomy. The therapist should ensure that the client's preferences are at the forefront of decision-making processes, providing education about the treatment options and empowering the client to express their wishes, regardless of family opinions, ensures that their autonomy is respected. Maintaining open communication is key. The therapist should be sensitive to the nuances of the family dynamics while ensuring that the client's voice remains central to the treatment process. Documenting discussions about cultural preferences and family involvement can facilitate continuity of care and ensure that all team members are aware of these considerations. Relevant guideline. The IATA's Code of Ethics and the AOTA Diversity, Equity, and Inclusion Position Statement emphasize the need for practitioners to respect cultural diversity and client autonomy while providing equitable care tailored to individual needs. In response to increasing demand for telehealth services, an occupational therapy clinic is transitioning to virtual service delivery. What considerations should the occupational therapist address to ensure effective and ethical telehealth practice? Answer: transitioning to telehealth requires the occupational therapist to consider several critical factors to ensure effective and ethical service delivery. First, the therapist must ensure that they are equipped with the necessary technology and resources to conduct telehealth sessions. This includes reliable video conferencing platforms that comply with HIPAA regulations to protect client confidentiality and privacy. The therapist should also assess the client's comfort and ability to use technology. Providing technical support and clear instructions for accessing virtual sessions is essential, especially for clients who may be less familiar with digital platforms. Additionally, addressing any potential barriers to access, such as internet connectivity issues, is crucial to ensuring equitable service delivery. Therapists must adapt assessment and intervention strategies for a virtual environment. This may involve developing creative solutions for evaluating functional abilities, such as guiding clients through self-assessments or using household items as tools for therapeutic activities. Engaging clients in goal setting and intervention planning remains vital, ensuring they are active participants in their care. Moreover, maintaining ethical standards in telehealth practice is paramount. The therapist should obtain informed consent specific to telehealth, clearly explaining the limitations and benefits of virtual services. Regularly soliciting client feedback about their telehealth experience can help refine and improve service delivery. Relevant guideline. The AOTA Telehealth Position Statement outlines best practices for occupational therapy telehealth services, emphasizing the importance of providing client-centered care while adhering to ethical and legal standards in practice. As part of an advocacy initiative, an occupational therapist aims to raise awareness about the importance of occupational therapy in the community. What strategies should the therapist employ to effectively promote the profession and enhance public understanding of occupational therapy? Answer: to effectively advocate for occupational therapy and enhance public understanding, the therapist should employ a multifaceted approach that includes education, community engagement, and collaboration with other healthcare providers. First, creating informative materials, such as brochures, flyers, or social media posts, that clearly explain what occupational therapy is, the services offered, and its benefits can help demystify the profession for the public. Engaging in community outreach is another powerful strategy. The therapist can organize workshops, health fairs, or public seminars to demonstrate occupational therapy techniques and their impact on daily living. Collaborating with local organizations, schools, and healthcare providers can further expand the reach and visibility of occupational therapy services. Additionally, leveraging social media platforms to share success stories, client testimonials, and evidence-based information about occupational therapy can foster a greater understanding of its role in promoting health and well-being. Creating a dedicated online presence that highlights the unique aspects of occupational therapy can attract interest and engagement from a broader audience. The therapist should also connect with advocacy groups to participate in campaigns that promote occupational therapy at local, state, and national levels. This collaboration can amplify the message and encourage policy changes that support access to occupational therapy services. Finally, fostering relationships with other healthcare professionals can facilitate referrals and interprofessional collaboration, ultimately enhancing the visibility and perceived value of occupational therapy within the broader healthcare system. Relevant guideline. The ERTA's advocacy framework outlines strategies for occupational therapy practitioners to engage in advocacy efforts, emphasizing the importance of public awareness and the promotion of occupational therapy as an essential component of healthcare.